Good morning. This is Dr. Bill White again with the American Orthodontic Society, and I want to talk a few minutes this morning about two-phase cases. This is where there's something minor wrong early on. It may not be so minor, but you have to do certain things early in the case, and then you get that done, you stop. And a lot of times we put them in a retainer and wear that until the permanent teeth come in, and then we'll come back and start the second phase. They'll have their permanent teeth in the mouth in. The first phase, you're always in the mixed dentition in the first phase. So let me go ahead and show you this young man that we're talking about here, and he has a problem early, and we already have started this case, and we've already jumped the bite over, but I'll show you that on the models here. He had a class 3 when we started, a mild class 3 case. Now in cases like this, you want to go to the person's parents and see, or either of them class 3. If they're bad class 3, you got a problem here that you can't overcome the genetics of it. But if they're fairly normal, we can correct this. In other words, we'll bring these teeth out over this and use some class 3 elastics and go through the case, and it'll work out all right. Sometimes these get started in the mixed dentition, some crossbite or something where they breathe through their mouth and they form a crossbite, and this is probably what happened to this young man here. Let's look at his from the side. You see the maxilla is too small and it's inside the bottom arch, and this comes about from mouth breathing frequently, so he's got some functional problems too. And if you keep the tongue in the bottom part of the mouth and breathe through the mouth, if you breathe through the mouth, you're going to have your tongue down in the lower part of the mouth, and the tongue will widen the lower arch out, and then you'll be in a crossbite similar to this. So sometimes that's the problem. So you want to get started and do whatever is necessary to get this back in shape. So we started early and we expanded the maxilla, and we'll show this later on. Now we pushed these teeth out over here. They were kind of down here, and this is just temporarily out here. We've got to get this bone structure out in this case, so that the torque in the teeth or something like that. So this is maybe a poor cephalometric picture here, but we'll go ahead and work from there, and we can see that later. Now here is just another picture starting. Now this case had what we called an ectopically erupting 6-year molar, and you see this tooth is coming too far forward, and it has kind of eaten away a portion of this deciduous tooth here. Now a lot of these are a lot worse, and they'll be at this angle. This is not real bad. Sometimes you can just put a separator in there and push this tooth back, since you've got your roots on the deciduous tooth, and then that'll correct this, and this tooth can come on in. And I think that's what we did on this particular case right here. So he's got some other problems coming in like that. Now let's go ahead and get through this. Now we've expanded the upper arch. You see we got space here and here, here, and we've got the upper front teeth out over it, but they have too much torque. In other words, they're laying in like this, and we want to get them going straighter up and down, which we will do. So you start these things back in the early part, and we are using the deciduous teeth. You can see them right here bracketed, and you can use it. I use them all the time, and some people say you can't put your brackets and stuff on them, but you certainly can. Now let me go on here, and now this is a little further down the line, and we've got the upper teeth, and the overbite and overjet is good. You can see here, and this is forward a little bit down on the bottom, and we'll go ahead and we get him down there pretty good, and we put him in a retainer. Now this picture here, the x-rays are going ahead till we finish. This is 90, and we have him all permanent teeth in the mouth now, and we've got it all lined up, and we're nearly through with it, but we'll go back and pick up in the doing of the case, you know, the orthodontics, and then we stop. This is 91. This is after we finished the case, except we got this 3 to 3 down here of the brackets still on there. We need to put that on, but otherwise it's in good shape. He's got his wisdom teeth, and we probably have to do something with those unless his jaw grows a lot more. He won't have room for those wisdom teeth to come in. Okay, we're going along here. Now we're going back with the treatment where we started. The x-rays went all the way through the case, and now we're going to show some of the treatment in the mixed dentition. So there's where we push those teeth forward and expanded the maxilla to fit over the mandible, and we have to bring the back teeth up now to fill in these spaces. So we'll be using some class 3 elastics to do that. Now here the lower arch, we still deciduous teeth, you see. These are deciduous teeth. So this is 1985. I think we started this case in 83. And a lot of these cases you work on maybe 6 or 8, maybe 10 years. You'll do a first phase and wait quite a while, and then come back and do a second phase. And sometimes it takes several years before you're finished with a case like this. Now here we are in 1986. We've got it going better, but we're not ready to bracket the lower teeth. So, but we've got him expanded, and is making room there for the teeth to come in. But he's still got these deciduous teeth. These are all deciduous teeth right in here. And we've got to get those in before we want to get started on the second phase of the case. And now we've still got deciduous teeth on the bottom. And this is 86. And we take that off, and we put him in a retainer, and we went for a while with this retainer. But see, these are deciduous teeth. And when the permanent teeth come in, or just about the last baby tooth is ready to go, then we go to the second phase of the treatment. So this will go to 86. And here again, we've got him lined up. He's got good facial height. Everything is good in here. And this line the profile. So the guy has a lot going for him here, and looks quite well at that point. And looking at him there too, the facial structure's good. And there he's lined up smiling. He's got I think that's right. We're going over into the permanent dentition, except he's got one baby tooth right there left. I think these are all permanent. Oh, these are 6-year molars back here now, and I'm not sure about that cuspid, but we'll see here pretty quick. And this is 1989. So you can see it takes several years, and you can use these. That's still a deciduous molar there. He's lost this one. Now these teeth can drift forward. This will come up here, and that'll help close some of that space that we had. Okay, now we're in complete permanent teeth, and we put the brackets on all the permanent teeth, and we'll do the finish touches to the case. And so these are all permanent teeth that are in there. We've got a overjet, overbite, and the interdigitation looks good where the teeth are coming in like that. So let's go to the, now that's back, we've kind of gone backwards a little bit here. This is back, and now that's the permanent teeth in place. They're the permanent teeth. Somewhere in here we go to compare the start and the finish. Now this is all the permanent teeth are in place, and that's the permanent teeth on the lower. Even the second molars back here are in place. You can see both second molars on the bottom are in place at this point. And here we wanted to widen that a little bit more, so we put this large arch wire in, or the big daddy arch wire. We spread that out just a little bit more up there, and you can see how that does. And you can stick this large arch wire, this looks like about an 036, and you can widen this out at any time you want. You can widen these teeth, make it change the arch form, everything with adding this Big Daddy arch wire. Somebody else called it Big Daddy, and now that's pretty well finished. This is 1990, and the bottom is fitting into that good, and we've got it torqued properly. Now we take it out and put him in a retainer, and he's not brushing his teeth good at all. So we got a bunch of stuff on there. But this is 1991, so this has taken several years to do these two-phase cases, and sometimes you can lose your shirt. So you have to figure out what it is and charge for that at the first, and then go back and charge on the back. Now we still have got our the 3-to-3 bonded on the bottom, but we'll get that on. I don't think I showed that. Now the upper retainer's in, and that's the finish thing. And here it is when we started in 85, and there it is in 91. That's 85 and 91. 85 and 91. And that's a two-phase case. Excuse me. But anyway, this is a good example of that. I hope you enjoy this, and we'll gain something from it. Thank you very much, and I'm going to go ahead and stop.